Hi there, I'm going to go through the MFDS Part 2 exam and what you need to know. So we're going to go through quite a bit with this presentation. So what is the diploma, the application process, eligibility, what if you fail first time or second time? If you have any personal issues, what kind of clothes you should wear, what to do if you don't have the MFDS Part 1, and we'll include in this how to incorporate the MJDF, as well as the format for the MFDS Part 2 and common pitfalls. So first, let's just go through what the diploma actually is. It's 2 parts to the examination. Part 1, there's a 3-hour written paper of 150 single best answer questions, and Part 2 is an OSCE circuit comprising of 14 stations.
So just having a look at his notes that the previous dentist has written, he's 4 years old and seems like he needs quite a few teeth out. So we're looking at least 10 teeth out. And yeah, you're right. For a 4-year-old, that is a lot to manage. I mean, as an adult, I think we would find that quite tricky to manage at the dentist. But for a 4-year-old, it's quite a lot to ask.
So let's go through the application process. So applications for admission must be completed fully with the required evidence and accompanied by the full amount of the fee. And if the application is incomplete, the candidate, you'll be informed that no action will be taken until it is completed. And applications for the examination have to be received by the closing date and time specified in the calendar. And applications have to be submitted through the RCS England website, and both the Part 1s and Part 2s happen twice a year. If you've passed either the MJDF or MFDS Part 1 with the RCS, you get a 10% discount on Part 2. So let's go through the MFDS eligibility. So you have to have written confirmation that you've passed the Part 1 or the Part 1 of the MJDF, and we'll talk a bit more about that later. You have to have a primary dental qualification that's accepted by the boards of the dental faculties of the Royal College of Surgeons, and you have to have completed a year of full-time postgraduate experience in dentistry. If you've worked part-time, this can still be eligible as long as it's equivalent and gained over a period of 3.5 years. So what happens if you fail the exam? So you can have up to 6 attempts to pass the Part 1. Part 2, you have to complete it within 5 years of passing the Part 1. And you are allowed a maximum of 4 attempts at the Part 2 MFDS. If you fail to successfully pass within the 5 years, it means that you're normally prevented from applying for any part of the MFDS examination. And if you're resitting exam, you have to pay the full fee. It will be very rare to not be asked to pay the full fee. An attempt is defined as when you commence the examination, but for some reason don't complete either the Part 1 or the Part 2s. So let's go if you've got any personal issues. So the exam can be tailored if you have additional needs, such as dyslexia or permanent or temporary disabilities. And these arrangements are intended to ensure that you are able to perform to the best of your ability and then not to be discriminatory against yourself. It is your responsibility to notify the college when you submit your application of any additional needs you may have. And normally the applications for reasonable adjustments are required to be supported by written evidence, such as a medical report from your doctor, for any medical conditions, or an educational psychologist report if there's like a learning issue such as dyslexia. So let's go into clothing, which you may not think a lot about, but you should. So you must bring your passport to the examination, and if you can't do a passport, then something else that's official. Now, for the purposes of the examination, you will be required to remove any clothing or items which obscure part of your face. But the college will observe sensitivity in the visual identification of candidates. And to facilitate the assessment of non-verbal communication skills and interactions with the examiner, the college reserves the right to require the candidate to remove any item of clothing that obscures part or all of the face. So what to do if you don't have the Part 1 of the MFDS? So the following are currently accepted by the college, providing exemptions for the Part 1 of the MFDS, which is if you have Part 1 of the MJDF of the Royal College of Surgeons of England, if you have the Part 1 of the MFDS offered by the Royal College of Surgeons of Edinburgh or the Physicians and Surgeons of Glasgow. or if you have the Part 1 of the MFD of the Royal College of Surgeons in Ireland. So the curriculum can be found at this web address, and it's very long and detailed. But if you want more information about the curriculum, the Clinical Skills Pro course has all of the subjects that you need to know about with our gold standards videos. So now what you really want to know about, which is the format. So it's a face-to-face exam. It's 90 minutes long, which will disappear in a blink of an eye. It has 14 clinical stations, and of these, 11 are assessed stations where you actually be watched doing something, and 3 are preparatory stations that gives you time to prep for the next station ahead. So what is assessed? Your communication skills, your clinical skills, and your clinical reasoning skills. So you'll be required to attain a single minimum standard for the circuit as a whole in order to pass the exam. So let's go through the MFDS versus MJDF. So they're not the same as the specialty membership exams. And the MJDF is no longer conducted by the Royal College of Surgeons in England. However, the College of General Dentistry is committed to continuing the MJDF exam. And the Royal College of Surgeons England now only runs the MFDS. So let's talk about common pitfalls in the exam. So you'll be given 2 minutes of reading time, 10 minutes with the patient or surrogate, i.e. an actor, and the exam scenarios tend to not be that long. So remember, at the start of this, you all start the exam at the same time, so you may not start at the same station as everyone else. You'll all be starting at different stations. Don't feel bad if the examiner's not looking at you or not responding or giving you any non-verbal clues, because they are required to give you no indication. That's their job. So let's go through the nitty-gritty of the stations. So 2 stations roughly will be history. And in those 10 minutes, about 80% should be history and 20% management. Around 4 stations will be explanations, and this will be a key test of your communication skills. And you'll be giving the patient a diagnosis, prognosis, treatment options, and procedures that may be required. So you should not be taking an extensive history. And around 2 stations will be investigation, interpretation, and special tests, such as an OPG. And around 3 stations will be managing patient concerns or queries, such as handling complaints or getting consent or giving bad news. So it's important you build a rapport with the patient or actor. Time management, you don't want to run out of time and not say the key issues that are going to get you the marks. So practice with your colleagues, your friends, and your family's patients. Watch our videos that covers the curriculum to see how you get everything in those precious 10 minutes. And whenever you're practicing at home, make sure your timer is on in front of you, so that later on, when you get used to it, you'll be able to judge how long it's taking you to do things. Remember, if you finish before the 10 minutes, you won't be able to leave. You'll be sitting there in awkward silence. So let's go through some common communication errors. Not allowing the patient to speak, speaking over them before they have finished, not checking their understanding of what you have said, not summarizing your conversation, not allowing them time for questions, using medical jargon and not explaining it in simple, non-specialist language, and not offering written information, not offering a follow-up appointment, and not observing non-verbal clues like looking down, being tearful or upset, and just carrying on. So practice, and then just practice some more. So common pitfalls include, do you take any medications? Yes. What are they? I don't know the names. Yikes, what are you going to do? Do you have a list of your medications with you? Yes, I do. Phew, that's sorted that. Remember, the examiners are not trying to catch you out, but show you know how to get the information you need. And an example of a common station is a patient on warfarin needing a tooth extraction. And we have the gold standard for this, along with the guidelines you need to know. So you can go through how you're supposed to do these stations to maximize your pass mark.
You're right that we do things slightly differently for extractions for people who taking warfarin, certainly. Do you have any other health conditions?
So we've gone through a lot. I'd suggest if there's anything that you had questions about or wanted to check on, just go back and pause and have a think, and good luck.